It's been several weeks since I posted a medical update, so I'll use this video to talk about what happened after my surgery. I had open heart surgery on June 25th, and I've tried to focus as much of my energies as possible to recovering from that. So let's talk about going through open heart surgery. We thought we had everything planned and set up for the surgery ahead of time. But trouble started the day before surgery was scheduled when I went to the hospital for pre-surgery testing on June 24th. I went through the blood test and got all my instructions for the surgery scheduled for 12:30 p.m. on June 25th. As I was about done with all this, the phone rang in the lab. It was the surgeon's office tracking me down. They wanted to move my surgery time up to 7:30 a.m. That put us in a scramble, notifying people about changes, recalculating when to cut off meds and fluids, all at the last minute. We also had to pack the night before rather than the morning of the 25th. We left for the hospital at 3:40 a.m. on the 25th. Ryan followed us over. He needed to return to the house to care for our critters during the 5.5-hour surgery, so he drove separately. We first went to a staging room to get ready. And of course, by 7 a.m. we were told the surgery was pushed back to 8:30. Sure glad I got up early. At some point, I was moved to a pre-op room. Shortly after 7, my wife's pastor Katie found us. She was wonderful at just keeping us relaxed and talking. Katie took a terrifying moment in my life and made it easier for me. Finally, around 9 a.m., I got visits from the surgical team and anesthesiologist to talk through the plans. Around 9:15, I said my goodbyes to Katie, Ryan, and Monique, and they wheeled me to the OR. I remember rolling down the hallway thinking, this is it. This is really happening. I entered the surgical suite, and I don't remember anything else until after the surgery. Monique got a text at 10:15 saying the surgery was starting. Somewhere along the way, Monique's brother Bill and his wife Frida and our friend Brenda joined Monique in the waiting room to keep her company. At 12:19 and 2:22 p.m., Monique got calls from the operating room with updates. Then, around 4 p.m., the hospital concierge took Monique to a private consultation room where the surgeon joined her 20 minutes later to discuss this procedure. Monique learned the surgery was successful. The surgeon had done a quadruple bypass, not just a triple bypass. She did not do a valve replacement, and, as we had planned, they did an ablation. Monique went into phone call, Facebook, and text message mode to notify everyone about how the things went. We had set up a plan to notify people about the surgery as quickly as possible, and I think it worked very well, while reducing the number of calls Monique actually had to answer. Finally, they took Monique and me both back to my room. I came out of anesthesia sometime after that. I slowly realized that my greatest fear had been realized. They woke me up before removing the ventilation tube. I asked Dr. Hutchison about this possibility before the surgery, and she told me that I wouldn't remember the ventilation tube. Now I was wide awake and aware, while this thing was still jammed down my throat. And I was severely pissed. People who know me will tell you that I get a very recognizable look in my eyes when I'm extremely angry. Look at this picture. That is the look of a very angry Jeff. I kept pointing at it and motioning to get it out. I heard someone say something about me not being aware it was there. I heard Monique say, "Oh, yes, he is." I made a few hand gestures, including a couple of flip birds, to demonstrate that I was very aware and not at all happy. I asked to write a message. They gave me paper and a pen, and my writing included "take it out" and "lied to me." I wrote something else that the nurse failed to repeat. A tech ran after the respiratory person. They told me I had to wait 20 minutes for that guy to return. More vulgar hand signals from me. He finally came in, told me to cough, and pulled it out. I felt like I was being violated and was helpless to do anything. This was really the only disastrous thing that happened during the time in hospital, but it was horrifying. Imagine waking up, finding yourself helpless, trapped in a real nightmare. I felt like I was in the facehugger scene from the movie Alien. Monique was amazed that I didn't completely flip out during all this. Trust me, I did flip out as much as I could. It's a month later, and I'm still very, very angry that I was subjected to this. Ultimately, they did find the person responsible for the tube, and he got it out. Surprisingly, removing the tube was easier than I expected. The rest of the 25th I spent just becoming more aware. My memories of that time are pretty spotty. For the first couple days, the pain was milder than I expected. The chest itself had a burning sensation. I didn't have much pain from the ribs, but I was really behaving myself and playing within the rules. The pain blockers did a remarkable job of stopping the pain. They got me up on my feet the first day, but I don't remember that. Yeah. Well, I feel disgustingly good for someone who just had open heart surgery, quadruple bypass, less than 24 hours ago. So far today, I've got out of bed and walked across the room and back, sat in a chair, as you see me doing now, ate breakfast and lunch is on the way. So the surgery was extremely good for me. I'm hurting some, but not nearly as much as I feel like I should be hurting. And that may be coming soon. They may install the pain later on, I guess. But for right now, I'm doing remarkably well. And all the doctors and everyone says they just can't believe how well I'm doing. So it's been a difficult day, 24 hours, but it's going well. A day into this, they started asking if I was passing gas. I told them I was, and the nurse said she was happy to hear me say that. I told her women typically aren't happy when I admitted to farting, and she was quite amused. At first, I used a walker to go anywhere. It wasn't that I needed it. I just wanted it because I didn't trust my balance. Pretty soon, I gave up the walker for bathroom trips, but still used it for going on walks around the hospital. Over the next few days, I relearned or practiced how to do basic things. Stand, sit, lay down, go to the bathroom, shower, dress and undress. During the first few days, my friends Jerry and Tammy visited. These are two of the kindest people I have ever met. They got me on the phone with their minister to share a prayer before surgery, and then visited afterwards with a prayer of their own. From the second day, I did a lot of walking. First to the door of the bathroom and then back, then into the hallway, then all around the floor. On Thursday, they removed the drains that were still plugged into my chest, which didn't really hurt very much at all. I was surprised about that. On Saturday, they pulled the pacing wire and the central line. Again, that didn't hurt. I was surprised. On Saturday, I decided to push it and walked 3 times my previous long distance.
Just remember, we do have to go all the way back.
Yeah, we got quite a distance now. Okay, well, we can go ahead and turn it on.
I paid for that with a wicked headache and nausea the next day. Tip, don't push it. Today is Sunday, I believe, June 28th, at about 6:30 p.m. And the plan, the expectation had been that I would be sent home sometime today. Well, in the days leading up to this, I've had 2 days in a row where I woke up with a really bad headache. And then yesterday, I pushed very hard on my walking. I walked a long, long way, probably five times or more what I was supposed to walk. And it felt so good at first. and then got back to the room and everything, and went to bed, and wow, it just really kicked my ass this morning. Just a terribly irritating and nauseating headache, and as I say, nausea, and it was just rough waking up in the morning. And we talked with them about that for a while. They came to the conclusion I had probably just overdone it on the walking, and my system was saying, stop that. So I definitely paid the price today, but they came in and started talking about sending me home, and I started talking about, what the hell do I do if I wake up with a headache like that again tomorrow and I don't have a nursing staff to deal with it, kind of thing. I never really got a good answer to that question. Kept shifting off. Finally, at one point I said, I don't think I'm being listened to. And shortly thereafter, the nurse practitioner I was talking to kind of made it sound like, well, we're probably gonna keep you till tomorrow. And I didn't like not being heard, so I finally made it clear that needed to change, and somehow it changed. And so now I'm here on a Sunday night, and it doesn't look, at least, like I'll be released today. I'm feeling pretty good, although I still got a residual headache. The nausea, feeling nauseous is gone. This area is very tender right now. Definitely very tender. Just moving the cloth over the skin is like, that definitely hurts. We took off the gown thing and all the bandages and everything, and I have seen the wound in all its glory. It's really awful. But we saw that. I got in and took a shower today. The nurse, they said they were going to arrange for me to take a shower with a nurse. I'm like, whoo! I didn't know my insurance would pay for that. But got in there, and she covered everything up with the plastic cover and adhesive to keep the water out of that, and was able to take a shower and wash myself pretty well, which felt very good after so many days of laying here in sweat and stinking like that. So it felt good to get that done. That went very well. But boy, I was fatigued. By the time I got done with that, I was really tired, and ended up coming back to this chair and passing out in the chair for a while. So it's been kind of that way, a peak of effort and then conking out, and then a peak of effort and then conking out, with periods of pain and recovery from pushing maybe too hard at times along the way. So it's been a tough couple days. There's been more pain. I guess this makes sense. Let's see, Tuesday, Wednesday, Thursday, Friday, Saturday was 4 days. This is the 5th day. And all of that nerve blocker good stuff they had in there before, I'm sure, has all worn off now. So I am definitely feeling things as much as I would expect to feel them. And that was nice. First couple of days, those nerve blockers were in there, and I was like, oh, this ain't too bad at all. Yeah, just wait, Jeff. Yeah. So that has caught up to me, and so you move this thing across your skin at all, and it really hurts. You cough, or you clear your chest, or sneeze, or laugh, or something like that, you get a really quick reminder, you probably shouldn't do that. And then it happens again, because sometimes you don't have any choice. But so anyway, that's what's been happening these last couple of days. The doctors are all saying I look terrific. I'm healing extremely well. My mobility and everything is excellent. My metrics as far as my oxygen levels and blood pressure and all those things are excellent. I don't believe I've had any instances of atrial fibrillation, which was a possibility. So that's a good thing. That was a concern after the ablation, especially. So all of those things have looked very good, and it looks. I'm reasonably confident that tomorrow I'll be out of here and headed back to the animal house that is our home, and get to see the kitties and the dog again. Open heart surgery, out of the hospital after 5 days. It's just amazing.